Hello and welcome to another episode of the Sports Medicine Moment. My name is Phillip Adler. I'm the manager of our sports medicine program here for the Spectrum Health Medical Group. This episode, we're going to talk a little bit about basketball, switching gears, getting into winter sports. Basketball presents some different challenges from our outdoor sports. There's a little different conditioning that needs to take place. Have you conditioned anaerobically? Not so much long distance, but we're looking at those quick, short bursts up and down the court. Have you looked at your footwear? Are you wearing last year's basketball shoes, or have you broken in this year's basketball shoes before we get going? Talking to footwear leads us to things like foot pain, plantar fasciitis. The appropriate footwear, getting the right kind of shoe can help avoid some overuse injuries like a plantar fasciitis. The other thing is doing some conditioning and pre-work to make sure we're avoiding the overuse condition known as jumper's knee or patellar tendonitis. So some things to keep in mind. Those typically come on quick, especially when we're changing seasons and changing the activities that we do. So lots of jumping, lots of running, plantar fasciitis, patellar tendonitis. Make sure we keep a lookout for those. The other thing we like to talk about with basketball is maybe some hand injuries, some things to be aware of, some things we don't often think of. You're trying to receive a pass, you take a finger on a ball on the end of the finger, you can end up with what's called a Boutonniere deformity. So your finger is going to look like that, where you've actually torn a tendon in the extensor. So what we want to do is we need to treat that, splint it, get in to see our docs. If it's not at that PIP joint, it might be at that DIP joint. You get that mallet finger, take that ball on the end of the finger, and boop, there you go, extensor tendon's torn. We need to make sure we get that fixed. We need our fingers to do dexterity type activities, typing. We're all on our phones and what have you nowadays. So getting these deformities and these actual issues taken care of is important. Don't want to leave out our flexor tendons. It's not unusual to get a jersey type finger where going for a ball, we get the finger stuck inside someone's jersey, that we tear the flexor tendon. So we just need to make sure that we are taking care of those tendon injuries, getting in to see the doc, and getting back in the game by taking care of these injuries appropriately. So thank you very much for tuning in to another Sports Medicine Moment. This is Phillip Adler with Spectrum Health Medical Group. Don't forget to follow us on Instagram and Twitter at SHMG Sports Med, and we're also under the hashtag Back in the Game.